leading group of CPC has conducted a series of deployment, and the battle against this coronavirus has been implemented orderly. Today, we invite Madam Guo Yanhong, Inspector of the NHC, and also Madam Huo Qinghua, Inspector of Department of Decision Control NHC, Mr. Wu Zunyu, Chief Experts of CDC Epidemiology, and Mr. Wang Guiqiang, Chief Member of Chinese Society of Infectious Diseases CMA, Director of Infectious Disease Department, Peking University First Hospital. They will give us the introduction about the increase of patient admission and cure rate, as well as the reduction of the infection and mortality rate. First, about the update of the epidemic situation by February 6, 24 Beijing time. And provinces from the new confirmed cases reaches 3,143, Hubei 2,447, new cured cases 387, Hubei 184. On the day of medical observation, close contacts 26,762, new severe cases 962, among which 918 from Hubei province, new deaths 73, among which 69 from Hubei province, 1 from Henan, Jilin, Guangdong, and Hainan. New suspected cases 4,833, Hubei province 2,622. By February 6, 24 Beijing time, the new update of the accumulated cases are as follows. First one is the confirmed cases 28,985, among which 4,822 are severe cases. And with the new confirmed cases, 31,161, cured 1,540, cumulative death 639, suspected 26,359. For close contacts, 314,028. Under medical observation, 186,045. Reports from Hong Kong, Macau, and Taiwan totaled 50, Hong Kong SAR 24, Macau SAR 10, Taiwan 16. And we have 2 consecutive days to see the reduction of the new confirmed cases. It indicating our prevention measures had worked. So much about the update. Today, here, I would like to mention that the Hubei Wuhan City, the Central Hospital Dr. Li Wenliang, while combating the virus, he was infected. After all the measures tried to saving him, he passed away yesterday, and NHC extend our sincere respect to the relatives and the wives of Dr. Li Wenliang. We know that for those medical workers working in the front line, they sacrifice their own family life to contribute to this battle against the virus. They try to protect our people's health, and they contribute a lot. We want to Madam Guo Yanhong to introduce to us more about how we can. To this virus, we are still facing very challenging situation. The society, we need to care more about our medical workers. We need to unite as one to conquer these difficulties. We should resolute to win this battle against the virus. Next, I'd like to give the floor to Madam Guo Yanhong to introduce to us more about how we can implement our responsibilities for the prevention and control of the epidemics. Dear friends from the media, to implement the control of the epidemics is directly related to the safety and health of our Chinese people. Central government, State Council pay high attention to this. They have a serious deployment, and also people from all walks of life unite as one to devote to the combating of this battle against the virus. And we try to contain the spread of the disease and epidemics. We try to allocate medical resources, optimize the diagnosis and control of the disease. And we also enhance our management of those designated hospitals. And we also fasten the research and development of the cure and also of the medicines. Currently, we are in the critical period of the prevention and control of the outbreak. To implement the responsibilities, we need to have concrete targets. We need to try to understand our weak link and our strength as well as the limitations. We need to have more practical and comprehensive redeployment and further requirement, thus to improve the admission rate and cured rate and try to reduce the infection rate and mortality rate, thus to protect the health of our people. We have the following measures. The first one is what we call 4 principles of early identification, early report, early quarantine, and early treatment. We need to find those individuals affected in a timely manner. We also need to stick to the prevention first and enhancing the grade-based management system among the communities. And we need to try to improve the testing capability, shorten the confirming cases time, and thus to effectively cut the spread of the disease. Secondly, we need to support the medical supplies to Wuhan and to Hebei province. We support them as much as possible. We dispatch the medical workers to work in Wuhan and Hubei, as well as other counties and cities. We have already sent more than 10,000 medical workers, including doctors in the field of severe patients, as well as the respiratory disease-related experts. And also we have the national implementation policy, try to increase our management for those fever patients, close contacts, as well as the confirmed case, and we implement the quarantine policy as soon as possible. We make sure they receive the treatment in a timely manner. We also have the 4 centralization principle, namely the centralization of patients, experts, resources, and treatment. We also try to centralize those severe patients into the most competent hospitals, and we try to centralize those medical resources, and we also have a patient-based and case-by-case cure protocols were the options, thus to reduce the mortality rate effectively. Number 4, we try to research into some methods to cure the disease. We try to apply those effective methods in the clinical practice to save more patients. In particular, we try to play the full strength of the Chinese traditional medicine, and we improve the sensitiveness of those reagents, as well as the development of the vaccines and new methods. We try to improve the cure methods to improve the cure rate. At the same time, we try to implement this mandate locality principle. We try to stop the import and export of the disease, and we try to contain the virus. We have the law-based implementation of such prevention, and also we try to enhance our inspection and accountabilities of this job. Next, we will implement our central government strategy and deployment. We will increase our awareness of responsibility. We will be accountable. We will implement all the measures. We are resolute to win this battle against the virus. Okay, now let's come to the Q&A session. And as for the journalist, please tell us where you're from before you raise the question, please. Thank you. CCTV. President Xi Jinping mentioned that we need to increase the admission rate and the cure rate, reduce the infection rate and mortality rate. So there are 4 tasks. What kind of measures we already take, and what are the difficulties to reach these goals? What are the countermeasures for the future? Okay, I'd like to give the floor to Madam Guo Yanhong, please. Okay, talking about the reduction of infections rate, we try to implement all the prevention measures. In particular, we give quarantine to all the suspected cases, patient, and we improve the health promotion as well as their capability for receiving new patients at the community level. And also, when we identify a patient, and then we need some time for the determination of a suspected case and the confirmed cases. We try to shorten this process. We also stick to the principle for early identification, reporting, treatment, and quarantine. And we also enhance our management of fever clinic as well as the hospital management, and take early identification is a very important measure. We also have the centralization principle. For example, we try to transfer those patients into some designated area or hospitals to enhance their admission capacity. And according to the improved cured rate, we optimize our options for treatment as well as the guidelines for the treatment. We are now develop our treatment protocol into version 5. We try to summarize the experiences we gain during the process, and we also try to enhance the strength of the Chinese traditional medicine. At the same time, we add the strength of the Western medicines. At the same time, we try to allocate the medical resources from all over China. In Wuhan and Hubei province, they have the most patients, so they need help from the medical workers from other provinces and municipalities. So we actually have this nation-based allocation of the medical resources. As for the reduced mortality, we try to give better treatment for those severe cases. We have 4 centralization principle: patients, experts, resources, and treatment. So these are the principles focusing on the rescue of the severe patients, and we also centralize those patients into the most competent hospitals. We have a national level expert team, high-level expert team, which led by academician Zheng Nanshan and other academicians, and they try to enhance their supervision for the treatment of severe patients. At the same time, we have a real-time monitoring of the gap in Hubei and Wuhan to see if they need the resources. We just try to support them, and also we pay high attention to the protection of the medical workers. No matter during the diagnosis options or in other steps, all our experts try to give support to the medical workers who work in the front line to reduce the risk of infection for those medical workers. Now we are in the critical period of this battle. We are confronted with a lot of difficulties and challenges. In particular, in Wuhan and Hubei province, we have increasing number of patients, but limited resource of the medical support. And some of the people, during the process, they visit doctors. They are also encountered with a lot of difficulties and challenges. And also, as I mentioned, we have the principle for early, and we try to control infection into a minimum scope. So we need to do the job at the macro and micro level. At the same time, for this, the novel coronavirus is a new virus, new disease. It takes time to understand the spread of the virus and the treatment of this disease. We try to develop the measures to address this.
So these are the difficulties we are faced with. As the next step, based on these four principles of identification, early reporting, early treatment, and early quarantine, we are going to focus our medical resources on the treatment and diagnosis to increase the cure rate, and lower the mortality rate. Thank you. Thank you. From China Daily. Why we put in place this mobile hospital? Whether they are accommodating, meeting the needs of the patients, and what criteria they will be discharged, and what kind of situation will prompt them to be transferred to other hospitals. But do you think, in these hospitals there is a risk of cross-contamination, and also in areas, in these hospitals, where thousands of patients stay together, they're under a lot of pressures. Do you think that you are going to replicate this shelter hospital or mobile hospital into other cities? Mr. Wang? As I said at the outset, the biggest challenge in Wuhan is the increasing number of the patients and limited resources, medical resources on the other hand. That's why this shelter hospital is designed to accommodate and admit more patients so that those confirmed patients cause becomes another source of infection to other people. That's why we would like to increase and raise the capacity of hospital and to increase the cure rate of the patients. For shelter hospital, they are primarily accommodating these patients with mild symptoms or mild patients or cases. So that is the target for the shelter hospitals. And we've been working very hard, for instance, by dispatching more than 2,000 nurses from other places and locally to be part of this medical team. And also we put in place this mobile T3 laboratory, because all these patients have to be tested for confirmation. So they have to go through this PCR testing before they are admitted into this shelter hospital. Of course, I understand that you are concerned with this issue of contamination issues, because each and every patient in this hospital is confirmed cases. And also they but I don't think it's going to lead to any cross-contaminations among the patients, because all of them are confirmed cases. And also we have a designated medical team working in the hospital. So the shelter hospital is a very effective way to alleviating the shortage of medical resources. So this cross-contamination is the last thing we would like to do. So because our objective is to maximize our capacity of admission, and shelter hospital is the way feasible at this point of time. And also we put in place some psychological experts that offer some psychological counseling to our patients in this hospital. As Madame Guo said, the shelter hospital is an effective way for avoiding cross-contamination, addressing the big number of patients. So that's a very important, necessary method, because according to version 5 protocol, we have relaxed the criteria for diagnosis of this patient, for early quarantine of these patients and for early treatment of these patients. So as a result of which the number of suspected cases will go up. The minor cases, they only have very mild and minor symptoms with fevers. So they could be accommodated and well treated in this shelter hospital. And of course, also we have ways to deal with and treat those severe patients, those with flus and fevers, and also those old people, old patients, they will not be accommodated in the shared hospital. They will be placed in the designated hospital. So this is very special kind of condition and circumstances where people are segregated for early treatment. Thank you. Thank you. From China Educational Television. Looking and trace the close contact is very important for blocking the further spread of the virus. So what kind of measures you are going to put in place to quickly identify this close contact, and so that they will be cooperating, for medical observations, and what kind of criteria they will be off medical observation? For the management of the close contact is very effective for cutting further spread of the virus and lowering infection rate of the virus, and has been proven very effective as a management tool. So in order to trace timely this close contact, on one hand, people working on the ground have to do a lot of epidemiological team to do a lot of work. And also we rely on these grassroots clinics and agencies to work for this objective. For the suspected confirmed cases or patient with no symptoms, once they are identified, they will be centralized for quarantine. But where there is no such condition, they could stay at home for quarantine. And if patient they refuse to cooperate, then based on the law, the public security agency could take compulsory measures, which are conducive for preventing further spread of the virus, and also for the own benefits of the patient and for their early treatment. During the period of medical observation, which lasts for which is 14 days, if there's no further symptoms are identified, then they are off medical observation. For the suspected case, close contact, once they are off the medical observation, then they are off quarantine as well. So I would appeal to all the close contacts to cooperate with our local grassroots medical workers for medical observation, for health management, because it's not only in the best interest of the public, but also in the best interest of their families and themselves. Thank you. This gentleman on second row. From Hunan television station, I noticed this afternoon this measure with 404 prevention protocol. What are changes versus other previous versions? And also, what measures are put in place to make our prevention measure more effective? Thank you for your focus on this 4.0 version of the prevention protocol. Versus 3 previous versions, it's easier to identify source of infection and to protect the susceptible population. More specifically, the 4 areas of adjustment. First of all, a better description of the characteristics of the epidemiological features of this virus, which allow our medical workers to take effective measures for treatment and for self-protection. And also, the symptoms are further enriched for the purpose of maximize the detection of the virus. And also, the measurement become more effective in measuring the source of infection. And where condition permits, we would centralize those close contacts, especially by focusing on these patients, asymptomatic patients. And fourthly, and also has released the burden of the first-line medical workers in these areas as a result of this version 4.0 from People's Net. As you said, we had a lot of news of people being discharged from hospital. How many of them are severe case patient, and what kind of things they should pay attention once they are returning home? Madam Guo Yanhong, would you please like to answer the question? By February 6, 1,540 person has been discharged. Since January 30th, we see a lot of more people being discharged and leaving hospital. We try to summarize the medical records of those people discharged. So we look at the medical files of more than 500 patients, and we try to summarize based on these medical records. There are mild cases patients as well as severe patients, and some of them some of the severe patients have experienced a lot of complications in the treatment process. Based on the report in Hunan, a senior citizen of 83 years old patient has been discharged. And also, secondly, the hospitalization period for these 500 patients are 10 days on average. And also, as for the therapies, we concluded antivirus treatment or life support therapies, especially with TCM, all of them proved to be very effective. So we're being summarizing our experiences and to make it part of our guideline for therapy and treatment, so for the purpose of increasing cure rate. Let me add a few things about the severe patients, which is a top concern of you. Based on the statistics from Wuhan, some of these discharged are severe patients in the proportion of 6%, 6%, and 6% for the severe patients, and 1% is not so severe patients. So this figure makes us very confident. We have sent experts in ICU team to be fully in charge of ICU work, and also matched with ICU nurses. This morning, we sent a team of ICU nurses, 80 of them have been dispatched to Wuhan. It's going to lower the cure rate, increase the cure rate, and lower the fatality rate. Thank you. From Changjiang Journal, thank you. For many suspected cases, patients, they would like to have access to this nucleic acid testing. What kind of things we should do to shorten this testing time?
Thank you. Thank you for your question. It's a very important question. As for a nucleic test, This is one of the most diagnosis measures is the measures we use for confirming the case, because we mentioned the early detection and early quarantine. At the same time, they can receive effective treatment. All these are relying on the test of this nucleic acid test. In Wuhan area, we have new guidelines for the treatment for the clinical cases, meaning before they get the result of the nucleic test, if we find those clinical-based symptoms of pneumonia, and we need to give them timely treatment. We try to avoid the time delayed that due to the waiting of the results of the nucleic acid test. And generally speaking, we improved the capacity of the nucleic test. And just now, yesterday, NDRC just issued a report mentioning we have sufficient supply of the nucleic test reagent. And in Wuhan region, we encourage the medical institutions to carry the nucleic test. If they have, we do not have, as long as they have the PCR test capability, they can implement the test. So we have sufficient supply of the reagent, and we allow the hospital to implement the test, and then we can screen effectively those patients who need quarantine or who need treatment. And also, when we talk about nucleic test, we need to have the fast test among those suspected cases to determine whether they are confirmed cases or they are discharged. For those suspected cases, when they hear a negative result, or when they receive the negative result, they are discharged and they can go home. So it can also reduce the pressure of those medical institutions, and we also can reduce the spread from those suspected cases to other people. And currently, I believe nucleic acid test capability has been improved substantially. So in Wuhan and all over China, we have no problem for this nucleic test. But we still are waiting for some fast test, which can allow us to have quicker result. In some grassroots areas, for example, they don't need to have that stringent standards to implement the test. And we are now researching into these methods. Okay, this gentleman, please. Thank you. I'm from New Beijing Daily. According to the media, we have many severe cases in Wuhan. However, we lack of the ICU nurses and doctors, which is a challenge for us. And now we have great support to Wuhan from all over China. So with many other nurses and doctors support Wuhan hospitals, do you think this shortage of ICU doctors and nurses can be resolved? Yes, what you are mentioning is true. During our treating of those severe patients, we have huge shortage or a huge gap of those competent ICU doctors and nurses. In particular, in Wuhan hospitals, many ICU workers or doctors and nurses, they work for a very long time. So based on this problem, NHC has enhanced the support in terms of doctors and nurses. As I mentioned, we already sent more than 11,000 nurses and doctors to support Wuhan, among which 3,000 are doctors and nurses practiced in the severe patients treatment area. And also, we have the most competent ICU expert team. They are now also working in Wuhan to supervise and to discuss and to have the visiting tour around different hospitals to cure those severe patients. So, in order to improve our support for the treatment of severe cases, and we try to increase the number of ICU nurses. For the first batch, there were 600 nurses, and then we have more. In Hubei and Wuhan, nurses working in ICU has reached 2,000. Today, we send another dozens of the teams which can support this ICU patients, and counties and cities beyond Wuhan city, they also have this shortage of doctors and nurses. So we established a 16 province supporting the hospitals beyond Wuhan city. It's one-on-one strategy. One province support one city beyond Wuhan city in Hubei province. That's to enhance the rescue and the treatment of those patients. That's to support the medical service provision in Wuhan and in Hubei province. Okay, I'm from the health newspaper. And as you mentioned, there are 4 centralization principles which is proposed by NHC. Would you please elaborate? And beyond Wuhan and the Hubei province, do other provinces also need to implement these 4 centralization principles? Actually, as for this 4 centralization principle, patients, experts, resources, and treatment. And these are precious experience we gain from the previous practice when we rescue those patients. So we apply this precious experience in the treatment of this epidemics. So we try to centralize those precious medical resources into those most competent hospitals to give treatment to the severe patients. And when the patients become severe patients, they need high-level or highly skilled doctors. They also need support from multidisciplinary studies. That's to improve the cured rate. And that's why we have this 4 centralization principle. In particular, when we give treatment to the severe cases, it's not only in Wuhan. Even in China, we apply these 4 centralization principles. So, for example, we have number 1, designated hospitals, meaning if a hospital is defined as the designated hospital, it means that the hospital is capable of giving treatment to those respiratory patients. So that's why we mention the centralization of resources is very important. It's also the fundamental principle we follow to give treatment to the patients. Okay, let's continue. Next one. Thank you. CCTV. We know that February the 1st, we have the academician Mr. Zhong Nanshan and academician Li. They already visited Wuhan and stayed there to support. What are the jobs updates? And also we found that during the 4th and 5th day of February, we have a 4-digit number increase of the severe patients. I'd like to know more about the severe patients treatment. Okay, as for the question is about the practice of those academicians, I would like to ask this lady to answer this question. I admire our academicians, including Mr. Zhong Nanshan and Madam Professor Li Lanjuan and academician Wang Chen. They work in the front line and they led teams. We have the Zhong Nanshan team, Li Lanjuan team, and Wang Chen team. The focus for their teams is to try to cure those severe patients, critical patients, and difficult patients. They have done a lot and have achievements. For example, they have the group discussion about the cases. They raise their expert opinions towards those severe, critical, and difficult patients. And also they try to help review and revise our diagnosis and treatment protocols. They integrated the useful experiences into the new version of the protocol, which is very helpful for the treatment of the patients in the frontline hospitals. So they play the role of supervision and supporting. At the same time, these academicians propose their experts' opinions about the trend of the epidemics and also they try to develop the methods to prevent the spread of the disease. And also, they are academicians, they are experts, so they conduct research and other developmental studies to try to apply the science research results into the clinical practice as soon as possible. Thank you. And Professor Wang wants to add more. Okay. Just now you mentioned our academician team. Actually, with our protocol, we add new contents in version 5. For example, we have the sero-based treatment during the recovering period, in particular for the severe patients' treatment. Apart from the antivirus treatment, we also have the Chinese traditional medicine-based treatment, and also they integrated more advanced research to prevent the death. For example, we have the serum-based treatment in the Shenzhen. It has already got great result. They can replace or purify the patient's blood, and they have very good result. So with all these good methods and the combination of Chinese and Western methods, we have improvements for the treatment. It's not simply a virus-based pneumonia. They have some underlying disease there. 85% of the patients in Wuhan, they are aged 65 plus. And also, they have a lot of other underlying diseases, high blood pressure, more than 30 of the patients, diabetes, 20%. So you see, all these data shows you that for those severe patients, and they have other underlying disease, so we need to have the comprehensive methods to give treatment to them, not only pneumonia, but also we have to treat pneumonia and other underlying diseases. So it's a comprehensive solutions. And also NHC sent many experts to Wuhan to participate in the supporting team to support doctors there. As for shelter hospital, shelter hospital is a temporary strategy. When we mention the use of shelter hospital, in large stadiums or square, people may become very emotional. They affect each other emotionally, and also we lack of good infrastructure to support the medical practice. We need to rely on the local government to play the full role of different sectors to guarantee a smooth implementation of the sheltering hospital, thus to ensure those patients receive treatment in a timely manner. Okay, next one. This lady, please. Thank you. I'm from CCTV. We noticed WHO in February the 6th, in 11 and 12 in Geneva, they will have global experts meeting, and they will coordinate international medical resources to try to research into this novel coronavirus and try to find the solutions and vaccines for this new virus. I'd like to ask, currently, in terms of our cooperation with other international organizations, what are the measures and what are the cooperations? Okay, thank you. As mentioned, in terms of the prevention control of the outbreak, we are in the critical period, and we need to be first responsible to the health of Chinese people and the people from all around the world. And we need to work together with people from other countries to try to attack this virus. And also, we share the technical standards. We have the teleconference. We have the high-level meetings and conferences. We would like to extend our thanks to their support and their trust and confidence. Actually, their support gives us the strength to conquer this difficulty and to win the battle against the virus. Okay, let's continue. That lady, please. Thank you. I'm from Xinhua News Agency. Yesterday, we read the news about the pass away of Dr. Li Wenliang. We are very sad. We have a question. when we review the process of his infection, he's only 35 years old. However, from a mild symptoms to become a severe patient, it seems the time is quite short. Could you share with us about the report of the case?
Well, we don't have a lot of information on these specific cases, or the experts present are not so well informed of that specific cases. Last question. Thank you. From Xinjiang, New Beijing. February 5th, 2 new cases have been confirmed in Wuhan. 2 babies. The youngster one is the baby that just born, after 30 hours. So that kind of vertical infection by the mother, whether it's going to be, included as part of the next version of protocol. I saw many tissues being placed in many elevators, which are supposed to be used for cleaning the button of the elevator. But do you think the tissue itself may have some virus? What about this new baby being infected, and whether the issue of vertical infection, infection by means of embryo? We don't have sufficient data to support this argument. Perhaps, the infection is because of the contact once he was born. Actually, as part of this nucleic acid testing, I don't think we don't have enough support data to support the transmission by blood, which is a kind of vertical infection. So my preliminary idea would be transmission because of this close contact after the baby is born. Thank you. So now there are many reports about how to, the scientific knowledge about how to prevent this virus. So Mr. Wu has something to share with you about these tips how to stay healthy in this particular period. Many netizens have posed some questions. First one, many of us have been going back to work, and do we have to wear gloves? So the essential, is the sanitation of the hands. If we put on gloves, then it will prevent our, gloves of different kinds to prevent us from getting in contact with virus. But nothing's better than just wash your hands, which is most effective. So whether you wear gloves or not, please wash your hands frequently. Second question, in railway station, airport, when you go through security check, you have to get off your face mask. So where there are a lot of people around you, taking off your mask is going to be a risk. And also, as a part of the facial recognition process, you have to take off your face mask. But, it's going to last very short, so it's not going to be a risk for us. But it's better for you to keep a certain distance from other people around you. Actually, that's the practice, while you're going through this security check. So as long as you're done with the security check, just put on your face mask. And also, third question, in a matter of 15 or 50 seconds, you have been infected with the virus because you don't wear your face mask. Well, the essential is the distance between you and the patient and whether you have taken protective measures. This new virus transmission primarily by droplet, because of breath, because of speaking, because of coughing, because of sneezing nose. So, the distance is essential because it's going to get you infected because of the droplet. So, when patient speaks or coughs or speaking to you and you are not in protective gear, then it's easy for you to get infected. So before the whole virus is under control, if you go to a big crowd place, you have to protect yourself by wearing the face mask. And the fourth question about face mask. Can I use this face mask repeatedly because my stock is running out? Whether I could just wash them and then reuse them? Well, there are many tips. For instance, you don't have to wear any face mask at home if you don't go out. And in the community where there is no such patient, then there's no need to wear face mask in that community. So where you should wear face mask? Number one, when you go to a big crowd place like taking up the metro or buses, you have to wear a face mask. And also, as a medical worker, let me make it clear, for as ordinary people, you just wear ordinary face mask. So, for instance, when we go to but if you are a medical worker, you are taking care of those close contact, then you have to wear this medical face mask. And also, you don't have to use, just throw them away after one use. For instance, in my case, I change my face mask once or twice a day. Of course, N95, KN95 face masks that are very specialized face masks. But I don't think ordinary people don't have to use that kind of specialized face mask. It's primarily for the medical workers. There's no need at all for ordinary people to use them. It's a waste if they use them. So the idea that the more valuable, the more expensive the mask, the face, the better, that kind of argument is not solid and it's not correct. Thank you. Thank you. And that's the end of the conference, press conference. We're going to reconvene our conference, same place, same time. The theme for tomorrow's press conference is how to maintain orderly market order in this time of outbreak. Thank you very much for coming. Thank you.